So we're going to start recording this presentation and then this is not working. Okay, so thanks everyone, and for my person in here, I think we may be expecting some more people to come in, but most of our attendees are virtual. So today we're going to be covering applying to medical school and showcasing your experiences. This is a really important part of your application, just because when you apply to med school, a lot of students I work with tend to focus too much on their GPA and their MCAT score, and don't realize that the experiences section, letters of recommendation, are super important to your application, and just making sure that, you know, it's well-rounded, that you're a well-rounded applicant. And so that's why we want to touch on this subject today. So the agenda is we'll do some quick introductions, we'll talk about defining your experience and how you do that. We'll talk about documenting your experience and journaling. We'll go over the 17 core competencies as outlined by the AAMC. And then we'll go over examples of experience, and then we'll have a lot of time actually today for Q&A. And so feel free, you know, have your notes out, have your experiences out that you maybe have documented, and you can ask about those because we'll have enough time today for that. So quick introductions, my name is Jade Frame. I'm the Associate Director for Career Development and Industry Engagement here at the Career Center. I focus specifically on pre-health, pre-med, and I've been here for about 3 years now. I have a background in neuroscience. I have a background, my master's in counseling. So it's really a great combination of my undergrad, because I actually was pre-health in undergrad and kind of switched into counseling because I realized that was actually a better fit for me to counsel people, but I have a lot of knowledge just about med school and other graduate schools. So with that, I'll pass it on to Ron.
All right, so hi everyone. My name is Ron Reyes, Associate Director, like Jay, the basically co-pilot for Healthbeat. As far as background, I've been in higher education over 17 years now, about 12 years of that in admissions, and about 6 of that also during healthcare education. So I'm really excited to help students out with this particular process, is the application process. And then besides that, I've been at the UC almost 6 years now, half of that at the Career Center and the other half at healthcare education. All right.
Cool, thanks, Ron.
Yep.
So let's talk about defining experience first. And for my folks that are on Zoom, we have enabled captions. I know the sound can feel a little bit echoey, but if you enable captions, you should be able to, in case you miss a couple words here or there, you'll be able to just make sure you're catching everything that we're saying. So for defining experience, what are experiences? We get this question a lot. So internships can be referred to as an experience, leadership, clinical and non-clinical, which we'll go over the difference between those two. We have publications and awards, research, service volunteer, you name it. So anything that is not academic, you can actually put on your application if you feel that it is helpful for your application. And MCAS specifically allows 15 experiences. And so a lot of people ask, oh, if I have more than that, you know, how do I do that? Or if I have an experience that has multiple different roles, how do I do that? And so it'll just come down to how you feel you can advantageously list that. So for example, I've had students who have worked in a clinical setting and they've worked clinical and shadowed, so they divide up the duties in one experience. And I've also had students that divide up the experiences separately. So it really just depends on what makes sense for what you're listing. So we'll go over some of these. The top 5 that we tell students to really focus on are service or clinical first, and then service or community service, shadowing, research, and then leadership. With clinical being the most important, obviously, for medicine specifically, and PA for that matter. And then feel free, you know, for the folks who are here and in the chat, you can ask questions. We have someone monitoring the chat. So if you have questions as well, you can raise your hand. So service versus clinical, so service and volunteer experience is different. We define it as working with a population which is considered a vulnerable community. That can be working with refugees, homeless, so homeless status persons, low income families, or historically marginalized communities, or anything kind of along that line. You provide meaningful support or interaction to address socioeconomic disparities and challenges within the community. So some examples here at UCSD are the Mustard Seed Project, Education Corps, and Homeless Heal. So there are more than this. I've had students that worked with like Haitian refugees or working with refugees at the border. And I asked them like, how did you find this experience? And they're like, well, I actually just showed up to the MEDS conference and I met a faculty member and I asked, right? So a lot of students are asking like, how can I get that experience? You really need to just, number one, we have resources that we can try and share at the end. But number two, it's really just getting out there and asking questions because you hear a lot of things by word of mouth and not everything that we have on our list is everything that exists. So for clinical experience, it's different, okay? So it's very defined. It's working directly with patients, working with healthcare professionals, or working with healthcare professionals rather, in a clinical or hospital setting, providing healthcare treatment or education and contributing to the patient's healthcare outcomes. So it is very specific. Some examples of that are emergency medical technician, certified nurse assistant, medical assistant, phlebotomist, medical scribing, the free health clinics that we offer here at UCSD, healthcare internships, pathmaker internships. And so some examples here at UCSD are emergency medical services, Blind Samaritans, IHC, or Global Health Brigades. So if you guys have any questions of any experiences that you have and you're trying to figure out if this is clinical or not, feel free to ask, put that in the chat. But this is how we separate them out. Let's talk about research. A lot of the questions that we get are, is research really that important? And the short answer, I'm gonna say is no. Unless you're applying to an MD PhD program that obviously requires about 5,000 hours of research. And rather, if you're applying to an institution that highly values research. And you notice that that's kind of a part of their culture and their mission. So whenever you're applying to medical school, pro tip, look at their mission statements and just make sure that you fit that mission statement before applying. Because for example, UC Riverside, they want healthcare professionals who are going to work in the Inland Empire. So if you want to work overseas somewhere and you're applying to UCR and that's your personal statement, you're probably not going to be a good candidate for UC Riverside. And so there are other examples like that as well. So for research, where can you search for this experience? The UCSD Real Portal and Handshake are going to be the top ones. Okay, and then we also have Undergraduate Research Hub, who the director is really passionate about getting students involved in research, whether it's medical or another industry. So the URH is a great resource as well. I would say outside of that, it's going to be going back to what I said is word of mouth. I also oftentimes will advise my students to go to their favorite faculty member or go on the biology faculty page or whichever kind of faculty area that they're interested in. And I have them like look at what the people are doing for their research, and then they can either reach out to them by email or they can go to office hours. Some of the considerations for research are looking for work that really interests you. It doesn't have to be like a wet or dry lab. It can be like clinical psychiatry or psychological research. I have a student that has worked or actually just got a position with the ED or the eating disorder clinic, because UC San Diego Health has a great, one of the actually the best in the country for those who struggle with eating disorders. And so they do a lot of research there, which is super helpful. And so that's just one example, but there's so many different types of research that you can get involved with. Look at what interests you, your access to academic and clinical experience. So you have to figure out like which access you have to that. There's different academic and clinical experiences as a student that you have access to. And so as a student, though, the great thing is everything for students is available to you. Once you graduate, though, it does become a little bit more difficult, but most of that experience is going to be in clinical or hospital settings as part-time or full-time work. So I would say for research, like I said, is not a requirement for most programs. So you can not have research and still apply to medical school. I wanna let you guys know that is possible. I generally am advising students at least try one quarter, because when you get into medical school, you will need to do research in your program. And so to have that foundational understanding is really important when you go into medical school and how you're doing research, statistical methods and things like that. So I would say maybe just try one quarter. Outside of that, if you're not interested in it, find the things that you're most interested in. Maybe that's clinical. I know Dr. Bluma, who is the Dean of Admissions here at UC San Diego School of Medicine. He's actually spoken to our class before, because Ron and I, we facilitated class a couple quarters out of the year, but he came and spoke to our class. And he said that students are generally falling into like 3 archetypes. So the 3 archetypes are the servant leader, the innovator, and the healer. So some people, they may not feel like they're in that innovative space. They may feel more like they're the servant leader and they have like a lot of leadership, or they feel like they are more of a healer and so they have a lot of clinical experience, right? So think about what interests you the most. Don't just check the box just to say that you kind of did it. So I would say definitely talk to Ron and myself. Generally, we say try it to see if you like it. So that, I guess that is checking a box, but don't just keep doing it because you feel like you should. I think that is the summary there. The benefits though of research, if you choose to do so, are potential to learn academics and industry applications within that research. You have exposure to other parts of science. I would say the biggest pro is it's a good networking opportunity. So you can possibly get a letter of recommendation from the principal investigator or PI. So a lot of students that do research, they get that letter. And many of you may know that when you apply to medical school and other healthcare programs, you need at least like 3 or 4 letters of recommendation. A lot of my students are getting 4 to 6 letters of recommendation. And so this could be one of them. So I do want to let you know that that is helpful. Okay, so tracking your experiences. We do, we'll put in the chat the link for this, but we really need students to like track their experience, especially when we're meeting with you all one-on-one. It's helpful for us. So I get a lot of students, hey, like, am I good to apply? Do you think I'm a competitive applicant? So that's like a big question that I get for people who are ready to apply. I'm like, okay, I need to see a few things. I'll list those out for you. I generally like to see GPA, MCAT practice score if you have it, depending on which year you're in and how prepared you are for that. I generally like to see this, so tracking your experiences, the name of the organization, the hours accrued. I like to kind of see a general experience list because that helps me understand what is your theme on your application, because your experiences tell a story. I would say, like, if you don't remember anything else, your experiences need to tell a story. They need to show a theme. And when we get in personal statement workshops, which are kind of similar in some way for your personal statement, we like to see a theme of like who you are, what you offer to the field, what your future directions. I like to see it as your values, your vision, and your goals for your past, your present, and your future. Okay, that's how I like to organize it. Did you want to add something on or question?
We do have a question when talking about experiences. So the question is, which types of experiences should we prioritize? The example is this person has scribing, research, shadowing, and few volunteer clinics.
Yeah. So my question to you as a student would be, what story are you trying to tell? Right? It's exactly what I'm talking about right now, because we do get that question. I don't like to say, oh, just do this, because if I tell you to do a cookie cutter theme, you're going to be a cookie cutter student, and then you're going to fall into the middle majority of the application. So to answer your question, if I were to have to give an answer, I would obviously say clinical, because I did mention clinical is going to be the most important. When you are a physician, you are working with patients. So that is going to be the biggest thing, is giving more as much clinical experience, around 300 hours. Healthcare experience, about half of those clinical. Remember, clinical is very specific. It's working with patients in a healthcare setting, contributing to their outcome, to their patient outcomes. Outside of that, are you interested in research? Do you want to get published? If that's something that you really have an interest in, go for that, maybe see if you can get published. I had a student get published, I think it was called like the Challenger Journal or something, and it's a student-run journal here at UCSC, and they actually got published. Their research got published, I forgot exactly what the topic was, I think it was like equity in clinical trials and like informed consent, I think that was like their focus. But I hope that answers the question. I think all of your experiences are great, but really it's gonna come down to focusing on the things that you feel align with your theme. So we don't have an example of a theme, but maybe someone really wants to work with a certain community, like a certain underserved community, or work with a certain population that come, like maybe border populations here because we're in California, or maybe like refugees from different countries or different areas, right? So maybe that's like their theme, they really want to focus on that, so maybe they have more experience. If they do research, it's on that. So for example, my student, she worked with refugees, I'm using that as an example just because that's the one that's on my mind. She worked with refugees. She also did research, which was published, like I said, and the research was for clinical trials for underserved communities. Because a lot of these refugees were in clinical trials and there wasn't like follow-up with them. And so it was like an ethics issue, and so like that was a focus. And then they did like a Black Maternity Health Week kind of event with their student org, and that was a focus. So that doesn't need to be you, but I'm just trying to give you some examples of like how that student tailored their experiences on application, and they got accepted to UC Irvine, or they're matriculating there, so congrats to them. So we have a lot of examples like that too. Any other questions? So tracking your experiences, I know I just kind of touched on this, but it's pretty straightforward. Name of the experience, organization affiliation, the experience type, point of contact, which is super important. Start and end time, because you will need that for your application actually, the hours approved, which you'll also need. Do you want this to be a meaningful experience? You can notate that. You can't really see it, but right here, you can actually select yes, no, or maybe if you want that to be a meaningful experience, because you'll get top 3 meaningful, which we'll talk a little bit more about. But your top 3 meaningful, again, needs to tell that story, needs to tell that theme that you're trying to get across. And so when you're listing everything, think about how your experiences fit into that theme. Like I said, it's your values, your vision, and your goals. So you have to think about values. A pro tip is on the AAMC core competencies, they list 17 core competencies for entering medical school students. So if you haven't seen that already, you definitely need to check that out, because when they're evaluating you, when you apply, they are looking to see if you met all 17 of those core competencies. Some examples are adaptability, which I think is a big one, right? Resilience and adaptability, being able to adapt to your environment. Empathy, obviously, communication, leadership, all of these are competencies. So just make sure you're checking that out online. And I've actually seen mission statements that integrate like learning or growth mindset into their values, and their values are like in their mission statement, which is like 2 or 3 sentences, by the way. Think of it as like a thesis statement for your personal statement and your experiences. So when I'm coaching my students one-on-one, we talk a lot about mission statements and how to write that, because when you go into interviews, they're like, so why do you want to be a doctor? I don't want to hear all the ands and the ums of like, I want to help people, and I think this could be a great, route for me. I really want to hear your values, your vision, and your goals very concisely. And so that is like a super big piece of advice that we would give. Okay, so moving on, journaling and logging your work. The reason I'm kind of going on and on is because we do have an hour and a half, we have time for questions, so we have more time to expand on these things. But log your experiences, questions to ask yourself: who did you work with? What did you learn? Was it meaningful? How did this impact you? How does this experience inform your decisions about healthcare? What population or communities are involved? You want to document any important conversations. I actually like when students, when they're talking, they're writing their experiences, and we'll show you examples of what that looks like. I actually like anecdotes sometimes. Like I've seen experiences where it opens with, I had this conversation and this person said this, and that's how this idea came to mind, right? And they're kind of explaining their experiences in a narrative format. That is my preference, because I just find it more interesting to read versus saying this experience did this, this, and that, right? Almost like a resume. I just don't like that personally, because again, you're trying to stand out. And so these are questions to ask yourself to format it almost like a narrative. You want to demonstrate reflection and self-awareness. I think that's the biggest thing. The average entering a medical school student is, I think, 26. Correct me if I'm wrong.
Close.
I'm almost, is it 26 or 27?
It's up for debate.
Okay.
Certain data, but anyways.
We're gonna say about 26. And the reason I bring that up is because it actually gives you more time to reflect and have that self-awareness. Not saying that you're like, age directly equates to wisdom, but a lot of times it can, right? And so that self-reflection, that self-awareness, that more experience, you're a little bit more solid in who you are and how you're presenting yourself in your application, in your interviews. And they're like, you know what, this person knows who they are and they know exactly what they want. They seem to really be adaptable, resilient, and they will likely make it through our program here in medical school, because medical school is very rigorous, including like other schools like nursing, PA, other programs. So you're demonstrating that and you're telling a story, like I said, it's telling a theme, giving examples of your interactions. Any questions? Cool, so finding a common thread, your experiences should tell a story, and I know I'm kind of hitting this point home, and it's demonstrating your why. So consider these questions: what compels you to pursue this career, right? So I know a lot of people say like helping people is really important to me, but that is a very vague reason. So I would need you all to be more specific. Does anyone have a specific example? I've been talking a lot up here. Anyone in the chat have a specific example of like what compels you to pursue the career? And no wrong answers, it's just, maybe it's like increasing access to healthcare. I would say that's pretty specific. Increasing access for maybe specific communities. Some people want to pursue osteopathic medicine because they agree with the philosophy of DO. So there's MD and then there's DO. And so they'll talk about that, right? Anything in the chat, Ron?
Okay.
No, okay. So, how does this speak to your personal growth? Did you overcome any hardships or challenges? I would say this is a big one. Any hardships or challenges? Just because like, how do I say this that where I'm not being like not politically correct? So like a non-boring story generally is someone who has overcome challenges. So if you ever watch, like if you think of your favorite movie, you think probably about like the character development, the story, and how that person has overcome challenges to get to where they are. And so, not that your life is a movie, but when you tell your story, you really want to try and convey that, the challenges that you overcome. It's okay, we always get a question like, oh, should I mention this, should I mention that? I would say use your judgment. So for example, like if you've gone to jail, maybe you don't want to mention that, right? If you feel that it's not helping your application. If you feel maybe you had a mental health struggle that you've overcome, you learn more about yourself, I probably would mention that actually. I've had students mention maybe like mental health challenges, maybe like the death of a family member, like especially like in their first or second year, maybe their grades tanked, right? And so like they talk kind of about those maybe that's more of a personal statement, but sometimes there's an experience associated with that and they'll talk about that. I hope that makes sense. Okay, so a couple more slides here and then we're going to switch over to Ron. So we talked about the 17 core competencies. So I'm actually going to show you what those competencies are. So like I said, your application is more than the checkboxes. The AAMC provides you with the pre-health competencies for a reason. So there's 17 of them, and they publish them to represent key aspects that future physicians should embody. So you want to understand, number one, that all of your experiences matter. Even if it's working at Starbucks as a barista or whatever, if you feel like that has contributed to like a value that you've developed, mention it, right? And we have meetings with Ron and I one-on-one. We also can go through and say, no, I think that this is something good to mention, but hopefully you get enough information from this workshop to know that you can enter or like add any experience that you feel matters and adds to your story. Or adds clarity to your story. So no holistic review means all factors and experiences are part of the review process. So this is where a lot of my students are getting stuck. They're like, I'm telling you, it never ceases to amaze me. I meet with students, I get it because the foundation of education is like grades, right? It's like grades and academics and numbers and GPA. And so when I meet the students, they're so laser focused on that. They're like, I have a 3.5, right? Because I see that a lot. I have a 3.5, I have a 3.4, I have a 3.6, and the average is at 3.73. Like, what can I do to boost my GPA? What can I do to do, XYZ? My MCAT score, should I boost that? I'm like, yes, obviously, yes. Your MCAT score can offset GPA a little bit, but I've seen 3.5, and I'll talk about it in a second, but I've seen 3.5, 3.4 students get in over like a 3.9. And it's generally because of this holistic, so this second bullet point, the holistic review. Because they're looking at who you are and what your story is. And I've seen it time and time and time again from different admissions. Sure, there are schools that really focus on GPA and MCAT score, but I would say the majority of them, although you need to have a baseline, they are also considering, so actually Dr. Galuma, who again is the Dean of Admissions here at UCSD, I was really surprised to hear him say this. He was like, yeah, when we're looking at applications, you kind of decide who you already like, and then you kind of look at the GPA and MCAT score, you're like, well, I'm for an interview, even if it's like a 3.5 or 3.4, right? They kind of decided they like you by your application. And so that's why I want to mention the GPA, matters so much. And there's something else I was gonna say, the data is skewed. So this is something that I really thought about after Ron and I were talking about it. If you go to the medical school admission requirement data on the AAMC, you see that all the medical schools, all their data, you'll notice that there's like a chart, there's GPA on a scale, and then the middle is the median, and it tells you the GPA in the middle. You'll realize that the bottom, so there's a median, and then the 25th to the 75th percentile, and then the 10th to the 90th percentile. So I hope that makes sense for my statistics majors. I'm not a statistics major, I just know visually what this looks like. I recognize that the bottom 25% almost is skewed. So a lot of people are falling into the bottom 25% for a lot of these schools. And so I was like, how did they not know this? I kind of knew that intuitively, right? It's there, the data is there. So I would say anyways, I'm just gonna shift your mind away from GPA. So here are the competencies. I'm actually gonna list them all just so you know what they are. Commitment and learning to growth, cultural awareness, cultural humility, empathy and compassion, ethical responsibility to self and others. Okay, so that's under professional competencies, as well as oral communication, reliability, dependability. We talked about resilience and adaptability, service orientation, teamwork, collaboration, and interpersonal skills. So if you look at it, most of the competencies are falling under professional competencies, not science, thinking, and reasoning. Okay, so there's literally 2 science competencies, which a lot of my students are like, GPA. And a lot of that is human behavior, living systems, physiology, anatomy, bio, chem, OChem, all things, right? There's only 2 competencies that fall under that, all right? I'm not saying that your grades do not matter. I just want to zoom your perspective out to see them in context of your entire application. Thinking and reasoning, so critical thinking, quantitative reasoning, scientific inquiry, and written communication. So that's a lot, right? But you notice when you write down your experiences, you can actually meet more than one competency per experience. So for example, if you work as an emergency medical technician, which I've seen, a lot of students will do that over summer. They'll need something like maybe empathy and compassion because they meet a lot of people who are very hurt or even dying. Maybe reliability, dependability, maybe even adaptability. I think that's a big one for emergency medical services, and teamwork, right? So they meet 4 or 5 in one experience. And so it feels like a lot, but it's more go out, do all the things, develop as a human being, get your mission statement down, develop your values, your vision, and your goal. And you ultimately will probably fall into these 17 competencies if you're putting in that. So that I think it's you now.
But actually go back to that slide.
Yes.
There's one thing I will point out that is an update from the previous years. That is more and more conversation piece within healthcare. And so one of those things is cultural humility and cultural awareness. So that used to be, I believe, one category, but they decided to separate it for a couple reasons. One is they want to change the dynamic of how we think about culture and interacting with populations, but also an awareness that we are more and more in a multifaceted, multicultural context when it comes to populations that we serve in healthcare. So one of the big things one of the great examples that we talk about, I actually talked about this in another class this week, is cultural humility. And I even, one of our alumni was there working in refugee health and public communities as her profession. And so one of the big things within healthcare right now is cultural humility, because it's understanding our cultural context and values does give us some reference point, but we also have to be have a sense of humility, because even if we have similarities or shared experiences, our experiences are still technically unique and not necessarily reflective of everything that our population is experiencing, right? So we have to take a step back and say, I can validate and empathize and understand, but I can also recognize my experience isn't necessarily going to be reflective of every single individual, much like every patient is a unique person and is not necessarily reflective of the rest of their population, their community, right? So there's this humility and understanding that there is cultural commonality and things that we want to focus on, but we also have to be aware that we aren't going to be the know-all and solution provider for every single thing, right? There's a certain sense of humility that's going to be absolutely necessary to be an effective healthcare provider, especially moving forward into how populations are right now. So I want to point that out, because that actually is one of the more larger emerging themes when it comes to really thinking about how we service people and communities. And so that's been a big sticking point in healthcare recently. And it's been important enough that they actually rewrote the competencies 2 years ago to reflect that. So that's why I want to bring it. It's like, if they change something, it means because it's more current and there's a specific reason and logic for it. And we want to be aware of that, especially when it comes to application. In addition to that, when we're talking about competencies and frameworks, I also like to mention, even though for our DO applicants, it's going to be a little bit different, right? DOs have a little bit of a different set of competency frameworks. A lot of it is still going to be common with the AAMC, because at the end of the day, these are healthcare professionals supporting patient populations as a doctor, right? So medical knowledge, of course, ability to demonstrate patient care, professionalism, practice-based learning and improvement, right? So those are a little bit more loosely based. But if you think about the competencies that we're already targeting with, say, for example, the AAMC application, a lot of those things build into a lot of these other areas, right? Medical knowledge, critical thinking, scientific, patient care. This is where we're going to be looking at, empathy, collaboration, teamwork, professionalism also. So I would like to point that out because I always get questions. Well, I know we present competencies from the AAMC perspective, but we also like that because they're very detailed, and so we can utilize that resource to help us be better informed in general with how the direction of healthcare is going. So I just like to point that out because that is actually very helpful when we start aligning competencies to experience. And this is a sample. This is actually one of the slightly older samples. It'll probably look a little bit prettier this year. I just saw the new version of the AMPAS application today. And so this is just a good sample to give you an idea of how it starts to break down the information. Funny enough, there is a reason why we put on the experiential tracker certain things, because people are going to have to fill them out anyways, right? So hours, time frame, and then there's also going to be contact information, and then our actual descriptors. So just a quick breakdown, just in case people don't know. AAMC, you have up to 15 experiences. If we're talking a coma, so you technically have unlimited amount of experiences you could list with a coma. So DO applications give you a lot more room in that regard. Unlike a DO application though, AAMC has 3 most meaningful experiences. So 3 most meaningful experiences, that's an additional 1,325 characters. In addition to that 700 to say more about why this is important, why this is impactful to you. If there are 3 experiences as a reviewer, I should understand that you have gone through that gives us important information about who you are in the context of professional development. What does that look like, right? Those are our 3 most meaningful experiences. Pro tip, if we are doing 3 meaningful experiences, theoretically, at least one of them should also have somebody who's our letter writer. Because if I spent all this time developing something that's very important to me or experiencing something that is integral to who I am as a professional, ideally, there's also a professional saying, I recognize this person, here's my perspective on this great applicant who's been through an experience with me, right? It gives us, as a review, additional context that is super helpful from the admissions perspective. So keep that in mind as we're thinking about meaningful experiences. Are we also developing our relationships with professionals within these meaningful experiences? Again, unfortunately, AAM or ACOMAS doesn't have additional word count for most meaningful, so we have to be super judicious. And then the other thing that I would be thinking about is ACOMAS also lets you highlight more than 3. So you can highlight more experiences, but you have less word counts, so you have to be super thoughtful about what you can say within the limited amount of characters. So I always have to put that out there because it's a major difference, and I have students that do fill out AAMC and then go to ACOMAS, not paying attention to the difference in application type, and then realizing they have to adjust things, right? And then I think Texas is even a little bit more different than that. Yes, Texas has their own application for medical and dentistry if people did not know. All right, so now that we know the structure and what we're expecting, going back to our competencies, if there are any competencies you're not sure about how it applies, feel free to let me know. We've been reading a lot of personal statements and experiences this month and last month and probably for the next 2 months. So this is something we're very well versed in, is talking about competencies. But the way I like to think about how do we start incorporating them is that we are painting a picture of what this experience means and providing a lens of how that experience has either changed us, developed us, really helped us grow. And so we're going to have some experiences. I'm very excited. I have experience with real people, so this is always fun. But I want to put that out there to kind of preface the brain and make sure that we are thinking about, am I communicating these competencies through my experience and my actions, right? I don't want you to tell me I have compassion. I want you to show me what does that look like, right? When we're talking competencies, it's always about how do I demonstrate? So, quick reflection. Which competencies do you think you've either met or which ones you think what we can do to meet them, I should say. So, anyone want to say a competency that based off an experience that they are thinking about? Or if you have an experience where you got something but you're not sure what to communicate about it, now's a great time to just say like, I did this. And I think it might be that. And for my people in person, I'm going to ask you first, and then we'll see if anybody in chat wants to put anything as far as competencies, but I always like to just ask. Think of one thing you've done. It could be volunteering, a part-time job, it could be a student board project, but one experience. I think of maybe one competency. Oh yeah, and then we'll go back. So competencies here. Actually, I'll do the bigger one just so people can see it. So thinking back to the experiences, which is there a competency somebody wants to communicate or talk about based off experience? Then let me know if you see anything in chat too.
Yeah.
How are we doing? Thoughts? Yes.
I'm thinking resilience and adaptability because I was raised in an at-home daycare center, so I was always around kids. So I think and it worked alongside with my mother who owned the daycare center. I think that like the idea of like able to run a room and like able to monitor a bunch of different kids and kind of like so I think that like that adaptability being like that kind of environment where you see all these different things going on and trying to be there.
So resilience and adaptability, right? Could that also be service orientation because you're picking up the mantle of being a caretaker with your mom?
Right, yeah.
Right.
Up.
Is there also maybe so we got reliability and dependability, resilience and adaptability, service orientation.
Someone on the chat said, wet lab research applies to commitment and learning.
Yes, so you can have wet lab research apply the commitment in learning. It could also go under scientific inquiry, right? It could if you get published, it could be part of your written communication, right? And then depending on what you're researching in wet lab, like say for example, I am doing microbial research for purposes of epidemiology, and the work that I does helps me figure out maybe how to eliminate less probable treatment processes for microbes. In that case, then there might also be a commitment to learning about something very specific or a demonstration of some of those scientific areas as well. So I always like to say experiences are multifaceted because it is not just one thing, it is an experience, right? Otherwise it would just be a task, right? Task is very mono thing. But with an experience, we can be a little bit more comprehensive about what we've done as competency. So I like to walk through that thought process because as we get into our examples, it'll help us talk about the second half of what we're doing when we get to some of our case studies.
So before you move on, I have just a few comments for DO, and then I have a comment for competency. So for DO, going back, we have a question about do DOs get paid less?
No. When you are a physician, you are paid by your specialization, right? So if I'm a family practice, I am in internal medicine, yes, you are going to be paid a little bit less than my neurosurgeon, right? Like that's just the fact of the type of work, right? But as far as if you're a physician, MD or DO, realistically, no, because your pay is really based off of your assigned duties within that specialization, right? It doesn't matter if you are a DO or an MD or a podiatric. If you're doing the podiatric surgery, you're probably making the same, right? Even though those are three very different ways to get to the same physician specialization. So that's a way I like to think about that. Yeah.
And then the other question is, I think you mentioned the DO competencies.
Yes.
Which is separate from the AAFC competencies.
Correct.
Right, okay, so that's on the ACOMA's website.
Yes, it's on the ACOMA's website. The other thing I will say is if you're applying DO, you better know the difference, right? So that means understanding the kind of the tenets and the mission of DO as a separation from traditional approach to medicine. So understand osteopathic manipulative medicine, because that's going to be a follow-up question usually on your secondaries. And also understand kind of the culture of DO focuses a lot on kind of thinking both systems and holistically about treatment, right? So it's not going to be, I am looking at X, Y, and Z, and then I'm coming up with a treatment plan. Maybe some of that will also be, I'm doing kind of a conversation while having direct interaction and assessment of the human being in front of me, while asking them about their history, while asking about what their life looks like to see if there's additional behaviors, patterns, or information that is going to give me hints of long-term or other problems that may be contributing to that person's health, right? So it's a different kind of approach, even though you are both going to be in the same title, right? They just do it a little bit differently, especially in my primary care professionals. Hope that helps, whoever asked the chat.
And then I think we may have one more. So how many competencies can we apply to each like career or each experience? Some experiences seem to overlap with a lot.
That's fine. It's not a 1-to-1. It can be a 1-to-3, a 1-to-4, a 1-to-5. It'd be impressive to try and squeeze a 1-to-6. Probably that's a meaningful experience if we're talking word count, right? A single action taken within an experience can be a complete demonstration of a lot of competencies, right? So, and we'll go over that actually in the sample of things that I would think of, what am I getting out of the case studies? But I would say typically multiple. I usually see a lot of anywhere from 2 to 5. 5 being kind of hard to talk about. So maybe 2 to 3, maybe 4 is pretty common, but it doesn't mean that there can't be multiple competencies based off of what's been demonstrated, right? It's not a exact list. It is understanding of what does the narrative tell me about somebody's abilities and actions. And then as we're thinking about this, for those who haven't started the process of applying, this is just where we can think about really honing in on our experiences in timeline, right? So for my students that are online, just a quick tip, if we are a year away from application, we still have time to think of generation of what we want to say about experiences. If we are a month away from application open, which is May 1st this year, for my students doing that, then the focus is, can I get to understanding what are my 3 meaningful experiences I'm going to highlight? Ideally, I know what those are before I am committing to May 1st. And the reason I say that is because the other thing I mentioned, letter writers. If we don't know what we're focusing on in our experiences, it may be hard to make an assessment of what we are going to be communicating to our letter writers about our experiences, and therefore what our letter writers can say or complement or support in relation to what they're submitting alongside our application, right? Application is holistic review, which also means that they are looking at what is the perspective from the professionals who work with you, and how does that align or make sense with the experiences you're providing. So it's very important that we think, if we can think ahead, this is just a basic timeline to see where we can really drill down on our experiences if we didn't give ourselves time earlier to focus on those experiences. All right. So before we get into the, let me see here, I just want to hide my little display here. I'll do that later. Okay, there we go. All right. So what to avoid? I always like to joke and say what we want to avoid on application is basically being kind of bland or negative. It's the easiest way I can describe it, but we have some examples. So 3 things that we notice all the time that are going in the wrong direction of how to communicate an experience. First, I like to call it the sales pitch, which basically is, like Jade mentioned, kind of resume-y, which is they're telling me a bunch of stuff, right? So let's see here. Seamless collaboration, develop these skills, gain hands-on experience, and make a meaningful impact. Those are all like, I'm trying to be buzzword worthy, but not really demonstrating anything. I'm just putting a bunch of fancy words in and hoping that's enough, right? So we want to avoid the sales pitch when we're talking about these experiences, because it should be telling me something that demonstrates those experiences, right? And then the other thing is it tends to be like, these are the things I am, without necessarily giving context, right? So it's not really a good approach. Another thing that we see is the bad resume, where I don't know anything personable about the experience. I'm literally looking at job description, right? If I am a lab tech, I don't necessarily need to know if you did titrations or if you did very granular tasks, because if I know your title of what type of tech you are and the location and the area of focus within that, that's enough for me as a reviewer to get a general idea of what you do from day to day. I want to know something interesting, right? Were you excited about X in the research that you were being a participant of, or did you learn about something that made you realize that there are ways to apply industry knowledge to healthcare, right? Think of ways to provide insight that exists outside the job description, because a lot of times that can be very, what's the word? Unfortunate. It's not a good use of space, basically. And then the last one I like to note is my negative Yelp review. And so it's when I get this all the time, when somebody has experienced what they feel is a wrong, and then focus on what has wronged them as motivation in their experience. There's not necessarily something inherently bad about being galvanized to do something based off a negative experience. It's how we go about it, right? So say, for example, somebody is, I work with several students where they'll have like, I'm a first generation student and I'm the only one in my family who speaks English. And so I had to navigate supporting my family through healthcare challenges when it comes to communication, when it comes to understanding how to communicate properly between different cultures and languages, right? Like those are valid concerns. And those sometimes can have situations where maybe service wasn't properly addressed because there was a gap in the communication, or maybe they made assumptions based off of language proficiency, right? Those can be negative experiences that galvanize somebody to do something in healthcare, but I don't need you to spend, 700 to 1300 characters focusing on what's wrong, right? We can acknowledge it and say, this is an experience where I learned very quickly about this gap or this problem. Based off of that, this is the things I've done to help fight against that, right? So if it's a communication issue, I learned very quickly after this happened, moving forward, this is what we need to do to help people. And this is how it's shown up in my work, right? So we want to avoid focusing just solely on a negative inciting incident and really think about, there could be a lot of other contexts happening. Yes.
So for the descriptions, is it more important to give a holistic perspective of the tasks you were responsible for, or highlight the tasks, some of the tasks you're responsible for that give a meaningful experience to the person?
So I would say if a task is usually assumed, we can skip it.
Yeah.
And really just focus on the key parts of those tasks or what I've done that really helped me learn, come through some sort of adjustment, change, professional development, right? Like if you can focus on that, that's more useful to a reviewer.
So it's more important to focus on the things that really had an impact on you than kind of list like the majority or all of your tasks.
Yes, absolutely.
Okay.
Right, because as a reviewer, I don't need to know all that.
Okay.
I'm trying to assess how, especially when we hear the word meaningful experience, why is this meaningful? Is it meaningful because I learned something new? Is it meaningful because it reinforced certain things that I found important? Is it meaningful because I became better at something that I think is absolutely critical or important? Is it character defining, right? After going through 4 years of doing this particular volunteer, because I felt very driven by this community, I learned to be a leader by hosting and taking parts of these responsibilities on myself, consistent growth in being able to take the charge on something you're passionate about, right? Like it's that kind of level of description we're thinking about, not this is what I did on the day-to-day. Yeah. So hopefully that gives you some context of things to avoid. And then some examples. So this is the med assistant example. For the sake of people in chat, I will probably just have to read this very loudly. What do you think, Jay? Should I just read it out and then we could just kind of go through point by point?
Yeah.
All right, so med student, strong example. And I apologize again for people camera, you're going to have to see my site profile for a long time. So, or I'm just going to walk here because I prefer to stand here for that. And I'm loud enough for the mic. So, all right. So this is a med assistant job description, or not job, experience description. We have the 700 characters up top and then the 1325 at the bottom. This is also formatted similar to how it will show up on an application because it's basically 2 boxes right on top of each other. So I remember being surprised to learn in my public health class that many people struggle to access primary care because of insurance, being uninsured or underinsured. In fact, this fact is what first drew me to the role at this clinic, because their mission is to make healthcare more affordable and accessible to all people. As a medical assistant working in a heavy metropolitan area, I had the opportunity to interact with every patient that walked into the clinic, whether it was taking vitals, doing phlebotomy, or administering vaccines. Some of these patients had chronic diseases such as diabetes, and watching their slow transformation as their health improved at each visit was an exciting and inspiring experience. So even if we just stuck with only the 700 character count, we learned a lot, right? And then we're not even getting into the story part. right? So some interesting things that they decided to mention, right? If we're thinking about mission driven empathy, right? Wanting to be drawn to places where healthcare is more affordable to people who can't access it. Being able to give some context, this was a heavy metropolitan area, right? That's valuable to kind of understand what is the context of the people that they are working and supporting, right? Who am I trying to help? And then the types of interactions that are going on. And what about that was important to that person, right? And so the important thing was being able to see their health actually improve from access. And so even just in the 700 characters, they're really establishing what are key things I hope you know about this experience that actually mattered, right? Why is this important to me? And then now they've moved on to a specific example. So this is a traditional way they do it. So I had many memorable patient moments. One of my favorite ones was when John walked in for an ear lavage. And if you don't know what that is, that's basically a doctor will know what it is. But basically, they take kind of like saline solution, but usually more effective than that, and they put it into the ear to actually clear out the ear canal. And then for people who do not have proper, consistent hygiene or healthcare access, that's actually a valid problem to have. And it can get infected. There can be other complications with healthcare that happen from these types of things. So background context from the clinician perspective of what we learned. So I had many memorable patients. One of them, my favorite, was John, walked in for an ear lavage. I led John into the exam room, and I noticed he was visibly uncomfortable and annoyed. While I checked his ear for wax, he sighed and informed me that his primary care physician had recommended that he get an ear lavage last year, but he had been laid off soon after and no longer had health insurance. His hearing had progressively gotten worse and worse, and upon joining, won't say the doctor's name, redacted, he was elated to find out that we offered this service for uninsured members as well. The blockage was so severe, we had to have a doctor on site come in as well and we proceeded with the ear lavage. The next 45 minutes were a marathon as both the doctor and I continued to strip away layer after layer of ear wax. Okay, that must be a little intense. After a while, I saw John's eyes widen as he felt pressure in his ears release. John's smile lit up his face as his hearing quickly returned to normal. Seeing the genuine relief and smile flood his face was an incredible feeling. Through John's visit, I was able to assist in providing quality and affordable care to a patient who would have otherwise not been able to easily access the healthcare system. This moment influenced my desire to continue being an active agent in reducing barriers to healthcare as a future physician. So, competencies, we probably have a lot we can think about, right? So, if you can think off the top of your head, is there anything that stands out or things that you feel or noticed or thought about after hearing the experience? I would like to put this out there. And if we have any comments in chat.
No. This is a person that actually applied.
Mhm.
Did they get in?
Yeah, these are all people that did well.
All of them.
Yeah.
Because we have quite a few case studies and some of them get in and some of them don't.
Yeah.
It's good to see the people who do.
Yeah. This is awesome, right? So in the second experience, they gave us a tangible way where we saw that even though they aren't the doctor, they were able to contribute. They showed empathy, they showed awareness, they understood, I would say this is very much, if we reference some of the archetypes from School of Medicine, this is very much the compassionate healer person, right? I am looking at a way just to provide immediate support and care so that this person feels like normal again, right? They've been dealing with loss of hearing for over a year. That's rough. So, there's a lot here we can talk about: humility, compassion,
Ethical
teamwork, ethical responsibility, right? Acknowledging that not everybody has the equal amount of healthcare access and trying to find a solution by being one of the people who provide that access.
And I also think like the more perspective you can give and understanding like the context of healthcare, which is cool because it's kind of a public health focus. The better, because you can explain that you kind of know about the goings on in the context of healthcare in relation in this case like public health.
Like, this is really a good way to demonstrate, I'm going to this location with a clear understanding of who am I serving and why is it important that I serve these people, right? Already thinking from the clinician perspective. So this is a volunteer, because sometimes I get, well, I volunteered, I don't know how to talk about volunteer work in a way that means something. Here's a great example.
Do you want me to read it this time?
Sure.
I'll read it.
Okay, please.
Yeah, so here, because that was a lot. Okay, so this is for a hospital volunteer. I rotated through several departments, including medical, surgical, telemetry, ICU, birth center, recovery, emergency surgery, and behavioral health. In caring for patients, I take vitals, help with meals, ambulation, bed baths, telemetry, repositioning, group therapy session, and de-escalation. I've also had the privilege of scribing for births and surgical procedures, from orthopedic cases to laparoscopic robotic assisted inguinal hernia repairs. That was a lot of work right there. This person was very involved. I've learned the value of communication skills, have gotten a close look at how various staff come together as a team, and gained various experiences from having to use restraints as a vehicle to continue care to holding an excised appendix in my hand. I like this. So this is like very, like a very condensed, it's a lot going on in like one experience, right? They're doing a lot.
But they're also pointing out, so yes, as a volunteer, but I've been here long enough to do all these things.
Right, that's a lot. Like, I actually haven't seen one like this before.
Yes, this is somebody that put in like, they were like, we put like 500 hours. I'm like, yeah, it shows.
Yeah, it's depth of experience.
Yeah, depth for sure.
Also, before I continue, I've seen people, and I don't know if you've mentioned this, but I've seen people have like one,
Big one.
like one, so it kind of continues into the most meaningful. I've seen them do that before. So one night, I was ambulating a patient determined to take a walk, even as she clutched her walker till her knuckles were white. As I held her gait belt and wheeled her oxygen cylinder, I tried to divert her attention when we had to step to the side to let a gurney pass with a body bag heading into a COVID room. Alas, the diversion didn't quite work. It was certainly tricky when she told me that it's the third she's seen during her prolonged stay, and that's why she especially wanted to go home. In my role, I could sympathize with her and said, I can't imagine what you must be going through. I hope you get to go home tomorrow. But I realized that my momentary conundrum is nothing compared to that of the doctor. The doctor who has to tell her the next morning that she's still not well enough to go home, that she needs the network and support of the hospital. My experiences have painted practicing medicine as a humongous challenge, but one I aspire to rise up to. In my current role, I realize even starting simple with a listening ear and a friendly voice is enough to make a difference for a patient. I really like that.
Yeah.
That's a
I'm
good
proud of my alumni.
one.
Yeah, I recognize most of these students actually, so, thoughts, right? Yes, they did list a bunch, but that's because they went above and beyond in that position, right? They could have been somebody that was just doing the stalking room in the back, maybe having a couple conversations. But this is somebody who entered a time where they were already a healthcare provider in a very minimal sense in an underserved hospital. So the people who already got clearance to help were on board even during the pandemic. So this happened early on in the pandemic. This experience that they were having, but they had been serving as support staff in a volunteer capacity before then. And so this really kind of helped give context to, okay, I am not the doctor, but how can I do something just to make it a little bit better for somebody else, right? So again, another one where we can see humility and compassion,
Humility.
teamwork, you know, there's a lot going on there, but I think it's a great way to kind of see that, you know, what do we do with volunteer experience? A lot, right? We can do a lot if we take the time and we're invested in the experience. So that's another thing that I get. Now, research, I know somebody's like, oh, research. So I'll read this one because it is research, so there are going to be a lot of things that are very researchy. So for the research position, the description, in continuation of early research, I conducted 5 separate behavioral studies to learn how preschoolers and adults process stimuli. I collected data at museums and preschools and developed a new stimuli at the start of the pandemic to accommodate for Zoom online studies. We attempted to closely mimic the physical blocks and address confounds, like making sure animations adequately highlighted features. I trained other research assistants, learn new survey programs like Qualtrics to reach larger community and analyze participant data. I participated in the undergraduate research conference, I hosted that once, where I designed a poster presentation and presented a PowerPoint to faculty and industry research. So that's just saying like, here's how far I got with this position, right? And then the meaningful experience. I love conducting the research with preschoolers from, hi, what's your name? And you did a great job, thanks for playing my game. These interactions taught me the important conversational skills like how to get quiet kids to feel comfortable answering questions. I remember one participant trying to hide from the camera when I introduced myself. But after talking about his lunch at Chick-fil-A, he started to answer more questions and I was able to conduct the study. At the end, he surprised me by wanting to stay longer to show me his toys. Research has provided me with a unique opportunity for heartwarming interactions and a more in-depth appreciation of all publications. From analyzing data to thinking of new experiments, I realized how much research relies on collective effort of multiple individuals. I value discussion with the graduate students and principal investigator who guided me through literature review and how to build off of previous research. I'm thankful for the other research assistants that helped me conduct the studies. With all of their support, I was able to pursue a new project comparing attention fixedness between adults and children and have the perseverance to continuously revise old projects in hopes of novel findings. And so this is somebody that was potentially considering going the research route, but they focused on something that I heard from another research scientist, which is when we're talking about research, is there any opportunity to talk about the people behind the research? Add some context, right? And then I know for this particular person, they also have a hope of maybe doing pediatrics research. So just an example of where we could see how even with something that could be, we could be worried that it could get very technical and it could be cold.
Yeah.
There's opportunities to really talk about the interactions that made an impact on how they approach their study and research, right?
Yeah, because I was gonna say, like getting to the research one, it's just like, well, we'll see how this goes, because a lot of the research ones, like this is what I did, this is how many hours, this is what the research focused on, and it's very dry. Versus this one, it is very like warm, inviting, it's personalized, it's like very humane is like the word
Right.
I would use.
It added a face to the process,
Yeah.
right? Because we can understand both it also talks about communication skills, right? It's very tricky to get kids to answer questions sometimes.
Yeah.
Right?
And
Yeah.
and this is similar to my student who talked about the research that got published. The one that she wrote was very much focused on like what sparked her interest and working with the people involved in the research, if that makes sense.
Yeah.
So it was very like people focused versus like data focused. So I would say when you write your research, really try and like make it more humane, if that's a part of your example.
Yeah, or then another way to think about it, how does this help others, right? Because that's hopefully the intent of research is how to help others
The connecting.
and connecting that, right? And then the caregiver.
You want me to do this one?
Sure.
Okay, so Maria is an elderly woman with cerebral palsy, a spinal cord injury, and Haley disease. As her caregiver, I am, as she would say, her arms and legs. I make and feed her meals, shower and dress her, do her housework, take her to the pool for exercise, and complete whatever miscellaneous tasks she has on her to-do list for me. This job taught me what it means to be responsible for someone's care and well-being. On multiple occasions, I've woken up to a call from her asking me to come over right away because her other caregiver is too sick or did not show up. I have missed birthday celebrations, camping trips, and vacations home to care for her. But in the end, Maria is always worth it. I love that I'm able to help Maria live her everyday life, but our relationship is so much more than these tasks. Over our years together, Maria has become a close friend of mine. We have laughed over my failed cooking attempts, celebrated multiple birthdays and holidays together, and swam countless laps. Me serenading her while she kicked on on her back. One of my favorite memories with her is celebrating the 4th of July by watching Hamilton on Disney Plus, which I did that for one of my 4th of Julys too, which is really good to play, and eating hot dogs. She cried while watching the musical because she never thought she would have the opportunity to see it. It is physically difficult for her to get to a theater, and tickets are too expensive for her to afford with her government disability benefits. Working with Pam has increased my awareness of privileges as an able-bodied person and developed my passion for disability rights. Though the Americans with Disabilities Act has done wonders to make the structural world and people's minds more open, the world is still not perfectly built for her. For example, she struggled to get her COVID vaccine because the website would lock her out before she could make an appointment since she had to type with her nose, which is slow. As a physician, I will continuously advocate for accessibility to ensure people are able to live their lives unimpeded. That's a very memorable one.
Yeah, mine is the whoops, switched fake names in the middle, but other than that, it's forgivable, right? Because you have to redact names.
Yeah.
I
love that.
Yeah, so, because sometimes people don't give caregiver enough weight, in my opinion, right? They said, well, it's not fully clinical because I'm not in a hospital, I'm not working with a doctor. But I'm like, we're doing those 3 other things we just mentioned, right? I'm working directly with the patient. I'm providing healthcare education and treatment. And everything that this person does is giving that person quality of life, right? So even though this experience on its own isn't completely clinical, it's definitely healthcare. And there's other experiences where maybe they can talk about their healthcare experience from the clinical side. But this really establishes kind of an understanding of, is this person going to work with patients? Absolutely. They understand people and they want to help people and they're willing to give things up to do this, right?
This is a really good example. And I don't know if you saw the full application of this person, but they almost fall into that archetype I was talking about. Remember the 3 archetypes, the servant leader, the healer, and the innovator. At least that's what Dr. Bloom would use. I'm sure there's other archetypes, but I wonder if this person falls into like the healer archetype. Like if you were to look at her full application, because like I would imagine the most meaningful expanded would tell a full story of what the student is trying to portray about themselves.
Yeah. And usually that's when we think about it, like we will see these themes as we read meaningful experiences if they're really communicating what's important, right? Because usually a person's focus, right? Why am I doing this, right? If it's a meaningful experience and we can see their motivations and values and fit, we start to really understand who this person is and why this is so important to them, right? And then the competencies come naturally, right? If I'm a helping, thoughtful person trying to do clinical work because I want to do something that helps somebody else, it's going to read well. And people are going to understand what those competencies are very quickly, as long as we take the time to really address what's important. So I just love these examples because these are all awesome. So some final tips before we kind of do a debrief. Think about, what are the most meaningful to your growth as a person, right? Which experiences did you have strong mentors for? Because those are going to be experiences where they have guided you or maybe you've grown a lot. Which experiences did you learn most or gain some insight? Is there a transformative nature to the experience? What does that look like, right? Was there a shift in your thought process or how you go about your day because you did this? Reflect on the lessons learned, right? Distance travel, lessons learned. And then not every experience has to be significant, but it's good to highlight the best parts of each of these experiences, right? Again, I don't have space to say everything, but I have enough space to try and get something important out. And then always review, reflect, and invite others to read. And the earlier we start writing these things, the more time we have to sit with them and consider what we're talking about, what we're focusing on, and hopefully make the best use of that word count. So with that, we switch over to questions. Yes.
So we have one.
Oh, yes.
I lean towards the answer, just to preface, I lean towards answering yes to clinical, but this person asked, would companionship, volunteering, and hospice count as clinical or non-clinical, 2 hours a week for each patient, provide direct companionship processing support? I would say yes, especially if it's like in a clinic or hospital setting, because that's a part of the clinical rules that we laid out for you. Did you have anything to add?
I would say, as long as when we're communicating it, we also are thoughtful about what we focus on within that, if we're titling it clinical, right? So if I see something listed as clinical and they're talking about this experience in hospice. Well, no, we're talking about, okay, what am I doing with the patient? How am I providing support and care? Are there any professionals I'm working alongside, teamwork? To make sure this person is well taken care of in one of the most sensitive parts of their life, right? Near the end of life care is tough. I actually knew a nurse that it was a hospice nurse for 30 years, and it's a very unique skill to be that compassionate. So when we have those types of experience, absolutely can be clinical, but we also want to make sure to highlight those things that really have us show up as a clinician being supportive of the patient. Yeah. For sure. There's a lot of ways we can go about that, but yes.
Yeah.
Do I have anything else? Basically, okay. All right, other questions, experiences, like I don't know what to tackle with an experience or things that I've done that I'm not sure about. That's always a very common thing. I've done X, I have no clue how to talk about this. Yes.
So that one research example.
Yes.
I was talking, it was very humane as your name is Jade.
Yes,
Jade.
yeah.
As Jade said, it was very humane. But what if your research is like much more scientific and you simply work with samples, then do you try and tie it back to the population you're trying to serve by doing the research? Is that how you would make it less dry and cold and more like humane and like welcoming?
It can be,
Okay.
right? Like the things I like to think about, what about this actually excited, like I would actually bullet point it first just to get a visual of how does it feel, right? What are the things that I was excited about or that really changed what I did or was important? Were there things that I did that directly benefited, supported somebody else, and how proud am I of that? Is that something I'm proud of or that I feel that I can talk about? Is there things about the research that you realize really make an impact on maybe something that is important to you within either healthcare, being a clinician, or serving a population, right? Like those are the areas that I think we have a lot of opportunity to really see how something within research can be helpful, right? I had one student, they were categorizing CT scans to understand cancer. And the thing that they did not realize until halfway through scanning all of these documents was these were all patients that had passed away, right? And so suddenly, once they realized that, they realized the work that I do is to try and give additional purpose and reason from the data that these people are providing. So yes, it's tragic that they passed, but the goal is to try and prevent that problem from happening again or to do better next time, right? And so it changed the whole trajectory of how they thought about research, right? So really it can be anything from like, I realize now, to get to this common drug or to get to this prescription, this is all the work we did just to help somebody have a better quality of life, just a little bit, right? And so that's where I think we have an opportunity with research is really thinking about, okay, what about this really was important or interesting or thoughtful for me, right? Start with, was this meaningful? If it is, we should have something to say about what was important to me about learning and understanding and doing this process, right? And then connect it to how do I see myself utilizing this knowledge now that I've gone through this experience to really make better decisions or talk differently or think differently about what I do next. Yeah.
So we do have a few questions. I'm trying to like multitask and answer them by typing, but okay, so one question is when do submissions open for AMCAS and ACOMAS versus when it just opens to input your information? AMCAS is May 1st.
Yes.
It opens, submission is May 27th.
Yep.
And then June 27th, verified applications are transmitted to medical schools. And then you have ACOMAS, May 6th is the application opens for submissions. And June 15th, colleges begin receiving and processing applications. So for each, you have like about a month or so to enter your information and then you submit it when submission opens. We also got the question, does ACOMAS also have most meaningful and how can you highlight that?
That's tough.
ACOMAS does not.
No.
have most meaningful? Do you wanna expand on that?
So Compass doesn't have most meaningful, but they do have things you can highlight. And so I would say highlight the ones that you feel like you've done a really good job of demonstrating that experience. And then pro tip, there's still secondaries. So anything that doesn't make it to a meaningful experience, secondaries is your prime time to deliver, right? Because secondary essays come immediately after. And secondary essays are usually saying, why you? Why our institution? And usually when we're doing that, we're thinking about mission, value, fit. And a lot of the things that we talk about on our secondaries. I like to say if we had to edit or not keep things for personal statement, experience, or meaningful experience, guess what? We have a second chance. And that second chance is our secondary essays. That's the ground where we can still utilize that valuable information in stories. And if we don't utilize it there, we have a third chance, interview, right? So when we know our stories and our experience, it's never wasted, even if on an application like a COMAS, we're not going to use it there, our efforts still can be utilized very strongly once we get to those other aspects of the application. It's just unfortunately, I wish a COMAS was formatted slightly differently, but it's still better than some of the other application types out there.
Okay, so these are pretty technical questions, so like a follow-up, do you know what the word, okay, we'll go back to the accounts. By highlight, do you mean that there isn't more characters available to expand, but you just talk about meaningfulness of the story?
Right away, yeah.
Yeah, so that's correct, what you just said is correct, and for the word count for commas, it's a 600 character limit.
Yep.
And there's no option to like expand, so you really have to like just talk about it like it's your most meaningful.
And usually they'll understand from the title and the statusing, the rest of the context pretty quickly.
Maybe next time we can give like an example.
Yeah.
Of an comas and kind of what it looks like on our end once they submit it.
I'm really curious if I could ask one of my friends, but it's been a minute since he was doing the application. He's in residency right now, but I want to see if he has friends that were earlier in their program.
And then just to refresh, because we kind of had a similar question, MCAS word count is 500.
700.
So 700 plus 500, which is like, so it's.
No, it's 700 for the descriptor.
For the descriptor, but meaningful.
Meaningful adds an additional 1325.
1325, yeah.
Yeah.
So it's 1325 plus 700, do the math. Okay. I'm not at
1825.
Thank you, Ron. He's
Or
going.
no, 2025, sorry. My brain switched it to the 500. But yeah, no. You get like 2,000 characters a month easily between the two, and that's very, very useful space on the application. Again, some people take that entire word count and say, I'm just going to write it all out. If it fits within that word count, we're going to be very judicious about cutting and pasting and making sure we don't split a word in half and get it on there. Yeah, some people do that. Other people like to have their little contextual, like the one that listed a bunch of stuff that they did. Yeah, that's hard to work in a story while also listing. I did all X, Y, and Z above and beyond. That one needed to break it up just so that they could be strategic. Yeah, so it just depends. Any other questions?
Yes, I am just multitasking.
And then for my people in person, it is 12:30. You can stay if you have any extra questions, but otherwise, thank you.
Our secondaries for MD and DO,
30.
MD and DO have secondaries.
Correct.
Yeah.
And secondaries are really based around the institution. If we're talking DO secondaries, there's always a component of why DO.
Yeah.
So be prepared.
We have one more question. Music is a large part of my identity and I have a large following on music platforms. I want to list it as one of my 3 most meaningful, but I don't want it to obscure my why medicine. I have a letter of rec from my music professor and I'm also leading sound healing events in my hospice care, which is really cool, by the way. My question is whether I should lead with it in my application or just leave it as an on-the-side hobby in my application.
It could be a meaningful experience, but we'd also want to talk about all the other aspects of the application and see how they work together comprehensively as an identity.
Yeah, so if you don't remember anything, please figure out, to answer this question too regarding music, figure out your mission statement, which is your values, your vision, and your goals. for your past and in the context of your past, your present, and to a certain extent, your future directions. That's how, in my mind, I organize it. And so for like the music question and like how this matters to you, how does that align with your mission statement would be like my question to you in our one-on-one. And are there any what are the values, the vision, the goals for this? How does it fit in? And if you feel like it is a nice, like, it fits in pretty seamlessly, you can put it as your most meaningful.
Right.
Because we do get a lot of students like, but I would say just be strategic at the same time, because I've had students put like surfing as their top. And I think it would have been fine, except this student particularly did not get into medical school, which I think surfing is really cool, because I didn't see it matched into a theme on our application. I've seen, and it was a good application, but they fell into the middle majority, unfortunately, and they didn't get into medical school. So just make sure the difference between getting in and not is just making sure you are able to like coherently fit it into your story. So if it's music, don't just list music and then move on to other things. Like, how does music as your most meaningful tie into your overall theme of what you're trying to get across about yourself? So I hope that helps. Long-winded answer.
And usually that's we have a set, we do, so pro tip, we actually do appointments where we just talk about experiences and go over strategies, how effective are we communicating them, what is actually important to us, how do we want to discuss that? Are there things that are important, we don't know what we want to focus on, so maybe strategies to focus experiences in a way that makes sense, right? This is the tip of the iceberg, technically speaking, but it should give you a good overview of how to approach these, so that when we have more deep dives on this, it's a lot easier to get to those important bits of information you want to communicate.
Cool. And there's nothing else in the chat.
Cool, so stuff to All right, so thank you guys for hanging on there, I know that was long, but hopefully that gives you a lot to work with.